Hello, everyone. Thank you so much for helping out. My name is Ransom Anyema. I'm a final year radiography student, a medical writer, and also a YouTuber. So I have an amazing guest speaker. She's a medical doctor based in the UK, but I'll give her the pace to, introduce herself. So, Dr. Hannah, could you introduce yourself to the audience?
Hi, everybody. Before I go on to introduce myself, let me say a big thank you to Ransom for inviting me to come on his platform. And again, thank you because we've had a few hitches this morning, but he's been ever so supportive in getting us here. So, now to the meat of the matter. My name is Dr. Hannah Brew. I am a UK based general practitioner and occupational health physician. I'm originally from Ghana in West Africa, which is Nigeria's jollof rival. And uh, I'm looking forward for us to have a lovely conversation where I'll tell you a little bit more about myself and deep dive into what I do. Yeah.
Amazing, amazing, Dr. Hannah. Thank you so much for introducing yourself to the audience. So let's dive into the question. So the first question for you, Dr. Hannah, is you've got a lot of experiences, right? Which is amazing. So tell us, you've got such a rich mix of experiences, from primary care to public health and occupational medicine. So tell us, what really inspired you to take this pathway, and how do you bring all those lessons into your everyday practice? Talk us through.
That's lovely. I'm sure if when I was in medical school, if you asked me what I was going to do, I probably would not have said that I want to be a primary care physician or a general practitioner, and certainly not an occupational health physician because I didn't even know that occupational health practice was something as a profession on its own until I moved into the UK a little over a decade ago. So what informed my path? I'll give you a bit of background. So I finished medical school in Ghana and I moved into the UK to pursue a master's in public health with a plan of going back to Ghana because I had some ex in Ghana, some things that I thought could be done in the better way. And I felt like the saying goes, one man or one person might not be able to change the world, but one person can change one person's life. So I, I was hoping that if I'm able to do it, I'll be able to brighten the corner where I am, and my impact would not just be on a person to person basis, but then I would have a bigger and wider influence with my knowledge in public health. So that is what influenced my decision to relocate into the UK. As fate may have it, unfortunately or unfortunately, I took ill when I moved into the UK. So my plans to come to study public health and go to Ghana were aborted. And then I had to take a very different pathway. And that is where really I found myself. So whenever I talk about it, I say fortunately or unfortunately, because some people would say, oh, with such a misfortune happening to you, why would you see the fortunate part of that? But I found myself through my ailments and I found myself through my circumstance, and it's made me a better and stronger person. And in terms of my clinical practice, it's made me a better clinician. So a long answer to the question that you asked, it is through me being unwell that I found the branch of medicine known as occupational health, because I had to find an occupational health physician to certify that I was fit enough to return to work. And it took me a long time, almost 4 to 6 months, just waiting for a single appointment. So I thought, oh my word, that this must be a very crucial job, because it was crucial to my ability to go back to work. Without that doctor saying yes, I wouldn't be able to go back to work. And I thought, wow, if I'm able to learn and do this, I'll be important to people's life and help with people's recuperation, especially people who need work to be adapted to them and for themselves to be adapted to work. And that is the crust of occupational health. And that is the foundation of what I do on a day-to-day basis. So marrying all three together, my knowledge in general practice, and mind you, general practice is not when you finish medical school and then automatically become a general practitioner. General practice is a specialist program. So I'm a specialist general practitioner. I'm a consultant general practitioner. That's what I do. And with my background in public health, it helps me to see things from a broader aspect instead of just seeing the disease as an entity. I think about where it's coming from, who it's coming from, and how it impacts the person in their everyday life. So I am the kind of physician that if you come and see me in my clinic and you tell me that you have a knee pain, I'm interested in where you live. I'm interested in how you're taking. If you tell me you're living in a house and it has stairs, I'm interested in how many stairs are in your house. At what level do you have to stop? How long are you stopping there? If you need the toilet, how soon are you able to get to the toilet? So that is how holistic my path is and has made me in seeing my patients. The good side is that I give holistic care. The downside is that I have a tall patient list because everybody's waiting to see me.
Yeah, that's you definitely signed up for this, Dr. Hannah. So yeah, you have to face it, because you're really providing um a very important thing in the society at large. That's amazing that someone like you from Africa, doing incredible things, you know, back home as well, and also in the UK. Amazing. Thank you so much, Hannah, for talking us through about your rich mix of experiences, from primary care to public health to occupational medicine, and what really inspired you to take this path. Because these specialties are really tax needing, because you can't just do all of them. You have to be very like a superwoman like you before you can do all those kind of practices. So, Dr. Hannah, thank you so much for talking us through about that, journey thus far. So let's proceed to the next question. Now, you talked about your disability paralysis, because um that really made you to become a disability and accessibility advocate. Now, before you answer this question, you're gonna give the pace to talk us through about your journey with your disability that you fought and you conquered. So that's the first question you're gonna answer before prior to this question. So as a disability and accessibility advocate, what changes would you love to see in the healthcare system to better support patients and colleagues with disabilities? Talk us through.
So thank you very much, Ransom. What I say is that when it comes to disability, it always seems far away until it's you. I mean, no one sleeps and wakes up one day that I want to have a child with disability or I want a nephew, a niece, or even myself. It's never anybody's prayer that, oh God, please answer this prayer. I want to be not able to do certain things for myself. We never wish for that, but it happens. So what do you do then? Sit down, complain? No. I mean, life is not a fair wages employer. We get on with things. And so, yes, that is what I have done. I'll give you a bit of background. And it's quite interesting that we are in the month of June because the month of June is the myasthenia gravis awareness month, and which is the condition that I don't say I live with. I say it's a condition that I champion because it's a daily fight, and each day I win it, and that is why you see me here. So myasthenia gravis, it's a Latin word. We haven't quite adopted the English version, but myasthenia is just muscles, and gravis, myasthenia is muscle weakness, and gravis is grave, severe. So to translate it back into English, it just means severe muscle weakness, and it is an autoimmune condition that affects our affects nerve endings, and it leads to severe muscle weakness, like it says on the tin, and fatigue. And it affects certain muscles, like your neck. So every now and again, I mean, I run a podcast, and so people might see me that every now and again I either hold to this pose or I support my neck. It's not a stunt, it's not a beauty pose. It's just because my neck is literally falling off my head. So I need to support my neck to move on. So it affects such voluntary muscles like your neck muscle, your hands, your legs, your eyes. You'd have something known as ptosis, or drooping of the eye, and you'd have something known medically as diplopia, which is double vision. Some people experience difficulty in chewing and swallowing, which is something I have during my very bad days. And also there is a change in the tone of your voice. So I jokingly tell my friends that I don't drink alcohol, not because I'm a saint or anything, because everything that they need alcohol to do, I can do it by myself. Why? Because I can get my eyes to droop when I'm tired. I sound slurred, like I'm drunk, and I'm very unstable on my feet during my episodes, like I'm wobbly, like I'm a drunk person. So basically, these are the clinical presentations that it comes with. What is the prognosis? It's supposed to have I mean, it wouldn't kill you immediately, but it's really debilitating in that it affects the quality of your life. And there is no cure at the moment. So it's a condition that is being managed. And we are hoping that we are able to raise more awareness and get more people on board so that attention is drawn to it, because it's still considered as a rare medical condition. So in the month of February, we celebrated rare medical conditions. And in June, we are throwing light specifically on myasthenia gravis. And we're saying, if you're having these symptoms, see your clinician. It might not be that someone is doing you, like we would say in Africa, that if you wake up in the morning and your eyes are drooping, maybe it's juju, or maybe somebody is doing you, you should find it. It could be something more. Maybe it's an autoimmune disease. So you should find out, and then you can get help with it. So you what was the question again? Because I've gone a bit.
Like as a disability advocate, what changes would you love to see in the healthcare system to better support patients and colleagues with disabilities?
Mm-hmm. Right. So I wouldn't put the burden on the healthcare systems alone, although yes, the systems need to rally around. Um, again, because no two systems are the same. So if I talk about healthcare systems, it's really broad and non-specific, because even the healthcare system in Nigeria is really different from the healthcare system in Ghana. Come to talk about the UK or in the US. But as much as possible, I'm hoping that when it comes to research and development, more attention by the pharmaceutical companies is drawn to such rare conditions, because it's really debilitating and it really affects quality of life. Again, that is on the broader systemic level. When I look at the individual aspect, I'm a clinician myself, and I would just encourage anybody who is listening that if you're a clinician, listen. Let's be more attentive. Let's not be in a hurry to offer pills and potions to our patients, because sometimes all what the patient needs is a listening ear. I know you can't make me better, but if the fact that I know you can't make me better does not mean I cannot tell you that, look, I really had a struggle sleeping last night, or I'm really struggling with my handwriting because I used to write really nicely, but now because I'm having a poor grip in my pen, my handwriting is a bit wobbly. All you need to tell me is, oh, I'm really sorry about that, or let's see what we can do about it. A bit of reassurance and a bit of support. Let's put the human face back into the clinical practice. A bit of kindness. That's it.
Wow, Dr. Hannah, that was amazing. If Because I know that disability people or patients or disabled patient. They sometimes seem that nobody cares about them. They're alone on this earth or something like that. Just it's amazing that you're like the voice of the voiceless, Dr. Hannah, because there are a lot of disabled patients or people in general that can't speak up because of what they're passing through, because they think that nobody cares about what they're passing through. But it's amazing that you've had such prior experience that made you to become a disability advocate, like a voice of the voiceless, voice of the disabled, voiceless people out there. Thank you so much for doing that, and I love that you said about humanly treatments in the healthcare system. This is the reason why AI can take over medical professionals, because of the human connections. AI can't do that. They don't have that connections. They can provide some connections, but not humanly connections. So reassurance is really a very, that draws me to radiotherapy. My field, radiography. Radiotherapy is like a field, like a specialty. Like you have general medicine, general surgery. It's like a specialty in radiography. But when you want to undergo chemotherapy or radiotherapy in general, like you said about reassurance, you have to reassure the patient. There's something called follow through. You have to reassure the patient and also follow through after you're done with the treatments, because patients are really quite adamant sometimes that once they undergo either the therapeutic treatment or a chemotherapeutic treatment, they just go like that. Radiotherapy works with cancers, right? And cancers don't just die just like during radiotherapy, you know, or chemotherapy using radiations and all that to, destroy the tumor, also this, determining the tumor size and all that, the regions, and also applying some um, healthy treatments to, protect the healthy, organs around the tumor. But patients are really adamant to follow through, because sometimes there are some cancerous things that are really very, very disturbing. They're very stubborn. They don't just go like that after chemotherapy or after radiotherapy. It's maybe proper follow through, to check up on how the patient if is reviving, or how the patient is, how the tumor is, doing, if it's dead completely or if some of them are still intact. So that draws me to what you said about reassurance. You have to tell the patient, reassure the patient, make the patient quite comfortable that you, even though you can help to the fullest, but you can, reassurance can make the patient feel relaxed. So thank you so much, Dr. Hannah, for talking us through about that. So the next question for you
So
is,
you did mention that um, you were thanking me for being the voice for the disabled and me coming out so strong, and I'll give a lot of credit to my family, because
amazing.
I mean, when such things happen to you, so first of all, you need to be a person. You need to have some well-defined personal philosophies, because trust me, when the carpet or the rug is pulled from under you, I was the kind of person that would go to the gym twice a day. You know, I'm very fit. I'm very agile. For my personality type, I'm a choleric sanguine. So I always have a task to do, and I'm a people's person. And then all of a sudden, when I'm talking to people, I sound like I'm drunk. My eyes are drooping. My face looks funny. And people, it's hard to explain yourself all the time. It took a lot of support from my family, my husband. I mean, in particular, well, when I was diagnosed, I wasn't married then, but my family, my mom, my dad, everybody was really, really instrumental, just encouraging me, praying for me, helping me. And I found a lot of support from reading good materials out there. materials that helped not just with my faith, but also helped to strengthen my mind, because that's where all the business starts from. It all starts in your mind. So after I had gotten it right, and I thought, well, I can't wish it away. It has come, and it has come to stay. I'm praying for a miracle. But whilst we wait, what do waiters do? We serve. So if you go to a restaurant and you say someone is a waiter, how would you know the person is a waiter? By being serviceable to you. So whilst I was waiting for my miracle, or I'm waiting for my miracle, because I'm a person of faith, I'm a person of a Christian faith, and I believe in miracles because I see it every day in my clinical practice. So whilst I'm waiting for my turn, I decided that, well, I'm going to be of service to other people. So that has been my bedrock. And disability, we talk about it so broadly. It's really diverse. It's a big spectrum. So we have the invisible disabilities, and then the visible disabilities, from the physical disabilities to even the mental health disabilities, the ones that you would never be able to see. So generally, I hope that we will be able to raise more awareness, especially in Africa, where people tend to despise people, and then in our minds we have a certain image of what, if you have a disability, you should look like. And even beyond Africa, last week I was in America, and I was in my wheelchair, and at a point I got up from my wheelchair to do something, and the people were utterly shocked. It was almost like, oh, there's been a miracle, because that is what we think disability is. We have a fixed shape that you should get into if you are disabled, and that once you tweak from what people have in their mind, is either you are a fraud or you're not really sick. But we should open our mind to it, that disability is a broad spectrum, and I could go on and on with it, but that's not what we are here for today.
Amazing, amazing. Like I say, always in life we need like a support systems. It's amazing to hear that your family was your backbone. It's amazing that they supported you even to the last. That I always say that on my channel, that you need a support system. It mustn't be your family members, it could be your friends, it could be your partner, it could be anybody supporting you. That's amazing, Dr. Hannah. Thank you so much for sharing, talking us through about that story. I know the audience are really enlightened more. So the next question is, this question is very intriguing, because of the kind of work you do. Like you've earned a lot of titles, that really got me intrigued. So talk us through. You've earned so many titles, MBCHB, MRCGP, Masters in Public Health, DROCOG, DOCC But what's one lesson from real life practice that no qualifications could have prepared you for? Talk us through.
So oh, if I got the questions clearly, you want me to talk about why or how I got these qualifications? Or is the question about what have I learned that none of these qualifications could have gotten me?
Both of them.
Both of them,
Mm.
right.
Yeah. Yeah.
So, like I've afore mentioned, I never, this was not what I wanted to do. I didn't plan that. The only part of the script that I would say was according to the script was the part about me being a doctor. I knew I wanted to be a doctor right from childhood, and I had worked hard towards it. So that was the only part that had stuck to the script. The rest, I would say there is a method to God's madness. That God must have been doing something. So I've told you a bit about the MPH, what is a Master's in Public Health. That is the initial plan, and the plan was just to go back to Ghana after I did my finished my Master's in Public Health, and then I stayed on, and I had to. I was more surgically inclined, so I probably would have done obstetrics and gynecology. as a professional, I've been an ONG consultant because I love men's health and I love surgery. So I probably would have done that. But given my health condition, I physically could not pursue that role. But I'm not easily broken. I wouldn't easily give up. So because I wouldn't be able to do like a full membership of the Royal College. So in the UK, our specialties belong to colleges and faculties. And so because I couldn't do a full membership, I wasn't deterred. I went ahead and I still did a diploma in from the Royal College of Obstetrics and Gynecology. So which gives me a special interest in women's health, which is something that I'm already passionate about. So I'm passionate about women's health and I deal with things like dealing with menopause, contraception, um, everything to do with women and our everyday business, infertility, fertility, postpartum management, all the issues that we go through as women. That is my special interest. And so that is what I got the qualification in with the DRCOG, which is a mnemonic that stands for an abbreviation, not a mnemonic, an abbreviation that stands for the diploma from the Royal College of Obstetrics and Gynecology. And I've also mentioned how I chanced on occupational med. So that is the qualification that makes me an occupational health physician. That is the doc med, so diploma in occupational health, occupational medicine. So that's what it is. I also double in prison medicine because at the center of it all, I have a passion for marginalized people. I have a passion for people that we do not really consider and think about much. And oftentimes it tends to be women, it tends to be prisoners, it tends to be people of color. And so this passion has drawn me to these parts. So, like I said, I never sat down one day and said, oh, this is my 5-year development plan. I'm going to do this, do this, do this. They came along as life happened, really. So that is how come I have a certification in drug and substance misuse management, because my prison passion also birthed that. I hope I haven't left any qualification for now. And I jokingly say that I have another qualification. It's called MUM. I have MUM1 and MUM2. So I'm a mom of one and two. I'm and and for now that is a specialty that I'm really passionate about, and I'm working hard at becoming better at my MUM certification. Yeah.
Oh my goodness. Oh my! I told you that's one of the things that got me intrigued. On how you have a family and you have all this certification, still pursuing further. It's amazing. It's really amazing, Doctor Hannah, that you've earned so many titles to your name. But tell us, Dr. Hannah, what's one lesson from real life practices you've had, or even currently, that no qualifications could have prepared you for?
Life.
Amazing.
Life. I mean, you can never really be prepared for life. I mean, I sound a bit philosophical because I'm quite young. I mean, I'm not going to tell you my age, but I'm quite young. So for me to be that deep, it's because of what I've seen, because I was in my mid-20s and then all of a sudden I can't feed myself. I can't pick a fork to safely be able to pick up food safely from a plate to my mouth. It seems really simple, but all of a sudden I can't do it. I can't use the bathroom on my own. I mean, the last time I was sitting out, I helped a patient in clinic only last Friday, and she had suffered a stroke, so she had paralysis of the right side of her hand, and I had done a vaginal examination. So I was talking about my interest in women's health. So I had examined this lady, and she came alone, and I said, oh, do you want me to help you pull up your underpants? If you know it, our underpants is such an intimate part of anybody, even lovers. Some people, I don't even know how often you want your girlfriend or your husband to see your panty. It's such an intimate and private part of us that we don't want people to see. But I had finished examining her and she had to leave. And I could see her clearly struggling to pull up her pants. I asked her the first time. She said, no, I'll be all right. And she was behind the screen. So after a few minutes, I went back and I said, Miss, can I help you? She said, no. And I told her, listen, I have been there. I have been in bed for 6 weeks where I could not even wear a pants. So even your pants is more dignifying because I was in adult diapers and it took people to change my adult diapers for me. So I've been there. Would you want me to help you to pull up your pants now? She said, yes. So I went there and I helped her to pull up her pants. I helped her to pull up her trousers. And then I held her. I didn't just escort her from my consulting room. I escorted her to the door. So from out of my consulting room, another door, all the way to the door of her car, where she had her husband waiting for her in the car, and she just burst into tears. And she was like, "Say thank you to this doctor." And she couldn't even tell. I'm sure her husband was saying, "Oh, what did she do to you?" But she was just overwhelmed with gratitude. And this was an emotional moment for the both of us, As she was feeling emotional, I was feeling just as emotional because I know days that people had to help me to go and bath. They come and pick me in a wheelchair. They'll wheel me in the wheelchair to the bathroom. And at that time, there was no dignity. There was no, and if I didn't really care whether if I called the bell, all I wanted was a human being. I didn't really care whether it was a man, it was a female, it was black, it was pink, it was Caucasian. I just needed someone to help me because I was pressed and I needed the toilet. And anybody who came, I was grateful. Life doesn't prepare you for that. And I don't think that when I was in the hospital, I definitely had all these degrees, but it didn't matter. They didn't matter at all.
Amazing. That's I'm a real like I'm really speechless right now. I think we should proceed to the next question. I don't want to feel emotional right now.
Oh, bless you.
Please, please let's proceed to the next question. But if you have questions as well, as an audience right there, you want to ask questions about your health, or you have any questions pertaining to, you want to further your master, you want to do your masters in public health, you're really unsure, you want to get all the certifications, like you want to up your skills, Dr. Hannah is there for you. Her details will be on the YouTube description below. So do well to reach out to her, or you can drop your questions in the comment section. She's willing to answer your question as well. So thank you so much, Dr. Hannah, for that one. That was so emotional, you know. But let's digress further. So yeah, you made mention about you own a podcast, right? So how has your podcasting shaped your voice as a medical doctor and advocate? And what kinds of stories or conversations do you feel are still missing from the medical space?
Thanks, Ransom. So, beyond my podcast, I often am a keynote speaker and I talk about disability, I talk about resilience, I talk about women's health, prison medicine. These are my bread and butter. They are the things that drive me because, like I said, I'm not talking from a book I've read, I've been there, I've lived the experience, I've walked the walk, so I can talk about it. And so that's what I do. What brought about my podcast? So I am an international medical graduate. So in the UK and most other countries, when we talk about international medical graduates, they're also known as foreign trained doctors, foreign medical doctors. It just means that they are doctors who didn't get their primary medical qualification from the local area. So for instance, if I came to Nigeria, I will be an international medical graduate because I did not graduate from Nigeria. So that is, it's just a big word, but it's really, really simple. And there are struggles that comes with it, fortunately or unfortunately, because um every when you go to Rome, you do what Romans do. But sometimes the Romans don't have what they want written down that you can study all one day and start doing. So oftentimes we get ourselves caught up in little traps and it gives us a bad name. People say, oh, that's how they are. But really, we are not less intelligent or less smart. We just don't appreciate the culture. And Where are we going to learn the culture from? It's by interacting with the people, and these people don't talk to us. So how will we learn? It's such a difficult situation that we find ourselves in, especially I can only talk from the UK point of view because it's in the UK that I have lived. So this podcast was birthed from my personal unpleasant experiences going through and rising through the ranks as an international medical graduate. And I said, listen, experience shared is experience gained. You don't need to reinvent the wheel. Pick the wheel and add your own wheels and bells, whistles and bells. Just plash it up, paint it, make it more exciting. So what am I saying? You do not have to go through what I went through. I'm not the kind of parent, sometimes in our African homes or in some schools, your teacher will say, I went to school barefooted. No, if I went to school barefooted, I want my child to go to school in Tim's. If I went to school barefooted, I want my child to go to school in Air Force. I want things to be better for them. So that is my general perspective and philosophy about life. That listen, the fact that I have suffered this does not mean you should suffer it again. And there's this saying, I don't know where I heard it from, that dinosaurs are extinct today because they refuse to communicate. They refuse to pass on the secret bits to other people. Because perhaps if they had passed on their knowledge, our neighbor would have been a dinosaur. They would not have been extinct, Maybe I'd have had a dinosaur pet. But it is because they didn't tell their other friends, like T-Rex did not tell Pentasaurus or whatever that, don't go to that place. There's a pit there. They all went there and then they all fell in the pit. And today there are no dinosaurs in the world. As to whether it's true or not, please don't quote me. But all I'm saying is that it is important that we pass these knowledge on. We pass these bits on so that people do not have to do it over and over again. So basically, that is what I do on my podcast. And then apart from just passing on the knowledge and encouraging someone else, we celebrate our journeys. We celebrate the journeys of international medical graduates. So for the people who come on, you must not have gotten on yet. I mean, you must not have gotten there yet. You must not be the consultant to come on my podcast. Everybody who is willing to share their story is welcome, because we are not all on the same journey. So you may have spent a month in the UK, but you've had a eureka moment. I remember particularly one of my doctors who came, bless her, Dr. Odachi, and she was talking about her first time coming into the UK. She said she had been brought here as a little child. She was taken back, and when she was brought back again, I mean, she came back again. She came as an adult to join her partner, and she went straight to Glasgow. And when they opened the door of the plane, it was so cold. It was blistering cold. She said, "Take me back. What am I doing here? Oh my god! Oh my god!" I mean, you guys should see it. It's on my YouTube channel. He'll share the link with you. And such intriguing stories. And I live for these things, that we get to celebrate ourselves, because what do they say? That until the lion learns to share his own story, the stories of hunting will only glorify the hunter. I'll say it again. Until we, the lions, we learn to share our own story, when it comes to hunting, everybody would think that it is the hunter who is the hero. Why? Because it's the hunter who has words. So when he comes home, he tells his wife, "Oh my God, I'm the big guy. You should have seen what I did to the lion today." But what really happened was that he almost died. The lion almost finished him. But because the lion does not have words, it looks
Yeah,
like it is the other way around. So this is
amazing.
why I run my podcast. Yeah.
Yeah,
And it's
have
called the
you to
MaverickMed podcast, and it's on YouTube. So
yeah,
you can like
have
and
the link will be
subscribe
there.
to it. Yeah.
Amazing. The link will be on the YouTube description below. So do well to subscribe and share as well. Share stories, to elevate people. That's the major thing why we share stories. You know, to tell people that you're not the only person passing through what you're passing through right now. Because I've had a lot of stories on my YouTube. So I don't, because of time, I can't just start talking about those stories. Just check it out. So you can feel lightened the more. So yeah, the last question for you, Dr. Han, is burnout and balance are huge topics in medicine today. And how do you take care of yourself while doing so much meaningful work across clinical care, advocacy, and media? Tell us there.
Right. So I'm happy that more and more our attention is being drawn to the concept of burnout. Burnout is not novel. It is not a new concept. It's just that we are now drawing more attention to it. A few years ago, burnout was actually glorified. If you work and you are not tired, you're not working hard enough. So we've just evolved and we've come to a point where we are almost all, my emphasis is on almost, because still people are backwards and then they feel like, no, you must suffer to gain, but not necessarily so. How do I take care of myself? So I I practice a principle of misogi. Unfortunately, I don't remember the name of the guy that I learned it from. But what I do is that I have my year planned. It's unfortunate. I have my calendar, my year calendar here. So I have a big calendar for the year, and I have my year planned even before. So before my 2025 started, is finished for me. If you follow me, I have it all mapped out, and there are things that I do. I choose just one big task that I do. I don't overwhelm myself. I just do one big task a year. So my big task this year was um doing a bit more of my public speaking. That was my big task this year, because I'd been doing it, but I've been doing it on a smaller basis. So I just decided that this year I was going to go hard on that. And so that's basically just one. Don't I don't have a tall New Year resolution if I have to do this. No. And what I do is that for every quarter, which is every 3 months, I try to do two things that give me joy. And again, it doesn't have to be big things. So, for instance, I said last week I came from America. Well, that was a big thing. But I would have a picnic with my family: bread, juice, banana, groundnuts. We'll go and sit outside and then they'll play. So, just being intentional and mindful about planning your day and planning your life, it leaves room for, I don't want to say manipulation, but when you don't know how to plan your life, others will plan it for you. If you don't know, if you have nothing filled in, people would fill it in for you. So one thing is that you have to be mindful and intentional about planning your own life and planning your own activity, and give yourself pauses, give yourself places for rest, because rest is productivity. And my personal mantra is that dead men don't work. You can write it down. Dead men don't work. Listen, no matter how much you think that your work likes you or you like your work, they are only keeping you there because you are alive. Once you die, you will be replaced. Why? Because we don't keep dead people at work. It's not rocket science. Don't come and goof us. Don't scare us. We don't keep corpses at work. You are only beneficial to your work because you are alive. So you keep yourself alive so that you can go to work. Easy
Yeah,
peasy lemon squeezy.
yeah, man. It's not part of the work ethics to keep crops, around the working
No.
environment.
Imagine you
It's not
come
part
to
of the
work and
standard.
they've put your manager who is dead in the chair. Everybody will just run away.
It's not part of it's not suitable for the standards of the working environment. So I love that statement. Make sure you guys
dead,
write it down.
dead men
People don't
don't
work
work. Yes, I've
at
trademarked
all.
it. Dead Men
At
Don't
all.
Work by Dr. Hannah Brew. So whenever you quote it, add my name. Dead Men Don't Work. Dr. Hannah Brew says dead
Amazing.
men don't work. So take care of
Amazing.
yourself. And I've
Very
mentioned a
important.
few things by planning your year ahead, allowing yourself breaks, do things that give you joy. Learn to say no without feeling bad. If someone asks you to do something, if you think it doesn't align with your personal time, it doesn't align with what you have to do, by all means, I'm sorry. I'll think about it. I'll get back to you. My vision doesn't align with this now, or learn to say no. And if people think that if you don't say no, and one day someone tells you something that you don't like, you will magically say no. No, saying no is a muscle. And anything that there's the law of diminishing returns or disuse. If I tie my hand like this for up to 1 year, I know what will happen. This one will get bigger, this one will shrink. I will lose it because I've not been using it. It's really simple for dummies. So if you don't practice your no muscle, it will not magically appear when you need it. You need to practice saying no.
Yeah.
Be like your 2 year old, be like the toddler. Have you seen a child before? If you're taking something from a child, you will know because that child will now say, no, 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 no. Bring your childish instincts back. Practice saying no. Say it without guilt. Say it with a smile. And I tell my
Yeah.
children, no is a full sentence. I don't need to
Mm-hmm.
explain.
No
If I
much.
say
No much
no, no is
explanations.
no. So
Yeah.
these are some of the little things, amongst
Yeah.
others, that I do to keep myself well. And then more importantly, I'm a spiritual person. I'm a person of faith. I pray, I meditate, I fast. All these things help me to become to keep my balanced life jogging. And apart, and one other important thing is that
Mm-hmm.
help, help, help. Help is not a bad word. There's nothing shameful about getting help. If you look on my LinkedIn post, the last time, I think about a week or so ago, I posted, I actually have an electronic Hoover. That is how much I like help. My Hoover, I can ask it, it's a robo vacuum. I can send my robo vac on my phone to Hoover. So and I don't find it, because I don't find it shameful at all. I talk about it all the time. My husband helps me, my mother helps me. If you come and visit me, I'll let you childcare. I will let you, don't even try visiting me, because if you try visiting me, I'll let you help me with my children. I'll let you help. I will let you help me because I need help, and I'm not shamed. I'm shamed about it because for many years they feel that if you're a woman and you are a strong woman, you should be able to do it by yourself. Oh no, me, I can't do it by myself. You need to help me. So I've only been able to do it because I've had lots of help.
Amazing, amazing, Dr. Han. Thank you so much for your time today, Dr. Han. It was a pleasure to have you as a guest speaker on this amazing podcast. Like I said before, if you wanted to connect with Dr. Han, like I told you before, her details will be, on the YouTube description below. If you have questions, do well to as well connect with her, subscribe to her YouTube, and if you have questions, you can as well reach out to her. And if you can drop your questions on the comment section, she's willing to answer those questions as well. And so make sure to watch this video to the end because there are a lot of nuggets, a lot of them on this video that you have to grab first before any other thing. So, Dr. Hannah, thank you so, so much. Do you have any last words for the audience?
I would very much share about the concept of ikigai, which has been one of my grounding principles. So if you are watching, we can do this quick little exercise. Well, maybe you should stop, subscribe to my channel on YouTube, follow me on LinkedIn, and then come back for us to do this little exercise about finding our ikigai. So I want you to draw 4 intersecting circles. So just draw 1 circle, 2 circle, 3 circle, and 4 circle, and let them intersect like the Olympic ring, the Olympic circles, if you see how it is. And I want you to, in box 1, I want you to sit down and ask yourself this question: what do you love? Me, Ransom, me, Hannah, what do I love? I enjoy talking. I love people. So you can write it there quickly. And then in the circle number 2, I want you to ask yourself, in today's 2025, let's shoot it to 2030. What do you think the world needs today? I was talking about help. We need help. What do you think the world needs today? The world needs something that reduces burnout. Everybody's talking about AI. What do you think the world needs today? Put that down. Now, ask yourself again on the box in the third circle, what can I be paid for? What am I doing now that will earn me money? Because money makes the world go round. Listen, all these things that I'm talking about getting help, getting time, having picnic. If you don't have money, when you have that little time, you're thinking about how to get money. Even you can't even sleep if you don't have money. It changes your sleep pattern. Even your breathing changes if you don't have money. I'm telling you. I'm a physician. I'm not joking. So what can I be paid for? Can I do an extra gig? Is there anything that I can do? Note it down. And then for the fourth circle, ask yourself, be honest to yourself, because again, that is one of my guiding principles. To their own self, be true. Ask yourself, what am I good at? And ransom, when we do that, we will find out that between what you love and what the world needs, you would find your mission in this world.
Amazing. Wow.
Between what the world needs and what you can be paid for, you would find your vocation. And between what you are good at and what you can be paid for, you'd find yourself a profession. Between what you are good at and what you love, you find your passion. And when all these things come together, you would have what is known as ikigai, your sense of purpose, your reason of living on this earth. And that's my closing message for us all. I hope we exercise it and then you can share it with me.
Amazing, amazing, amazing. Thank you so much, Hannah. That was incredible. So make sure to participate. If you're an audience watching this video, you can't do it just now. You can think of what you can do to make money. You cannot get everything today. Just take your time to do it. Come back to do it. Think about it and all those things. So thank you so much, Dr. Han. It was a pleasure chatting with you today.
The
Thank you.
pleasure is all mine. Yeah. And